welcome to Health Power. First, to learn how to overcome relationship challenges, and certainly I'm very pleased to have you sharing your expertise with Health Power concerning relationships as a relationship expert, intimacy and relationship expert.
Thank you.
And I understand we're going to talk some this morning about relationship challenges, how to overcome them while living with a chronic condition. In this case, the chronic condition we will be talking about is rheumatoid arthritis. Is that correct?
That is correct. And I have with me Dr. Ava Dikranian, who is going to be talking about the rheumatology side of things.
It's a pleasure to be here. Thank you.
Yeah, hello to you also.
Hello. How are you, Dr. Goodwin?
Okay. For my audience, Logan, you are a well-known expert in terms of relationships, having appeared on Good Morning America, The Today Show, CNN, and being the author of 3 books related to that subject. So we're delighted to have a chance to talk with you this morning.
Thank you so much.
And Dr. Dikranian, I understand you're a rheumatologist, specializing in joint conditions, I guess. Is that a fair way of putting it?
Absolutely.
And affiliated with Sharp Memorial Hospital in San Diego.
That's right.
Okay. Then why don't we get started here? Logan, in the information I have before me, there's the term self-love. Well, before I have you talk to us about self-love, I don't want to forget to mention that next Tuesday is Valentine's Day. So for both of you and for our audience, let's say Happy Valentine's Day to everybody.
Happy Valentine's Day.
Okay. Now tell me what you mean about self-love and how one should practice self-love.
So self-love is an interesting concept because we focus so much on relationship health and communication skills, and all of those things are important. But the truth is, if we don't like who we are as individuals, as sexual and intimate beings, it's going to be very hard to translate that to someone else. So that means a deliberate recognition that we are entitled to meaningful, fulfilling sexual and intimate relationships. And to recognize that we don't always have to put our needs on the back burner for someone else. We are entitled to our feelings and our needs, and we should feel empowered in and by our bodies, even when our bodies present us with certain challenges.
Okay. And as far as dating and emotional and physical intimacy, does that all tie into the same self-love concept?
Well, it certainly can. One of the reasons Dr. Dikranian and I are here and why we've partnered with Pfizer on this Arthritis.com website is that in talking with people who had RA and other chronic illnesses, one of the issues that really was under-addressed was this idea of relationship and intimate health. And as we know, intimacy is such a big part of our lives, and finding ways to navigate certain challenges, whether it's in the self-love department or whether it's in the relationship communication or sexual function department, is just so important.
Right, okay. And another term that stands out is communication. How closely is communication linked to self-love, intimacy, etc.?
Well, you can certainly have self-love, but if you can't communicate your needs about what you want to someone else, then of course you might not have those needs met. So communication and good communication is not one of these brand new tips that relationship experts give, but the reason why we always give it is because it's so important. The thing to remember, though, is that we are not mind readers. Our partners are not mind readers. So it's important to thoughtfully discuss what we want out of our partnerships, but it's also really important to be a good listener and give our partners the space to talk about their own needs and expectations too.
Okay, this is a very good place for us to go into rheumatology as it might relate to love and self-love and intimacy. Dr. Dikranian, or Ara, if I may, tell us how the link exists between what I've been discussing with Logan and rheumatoid arthritis.
Yeah, so rheumatoid arthritis, for those who may not be aware, is an autoimmune condition that causes inflammation in and around the joints. It can cause.
Let me ask you. When you say autoimmune condition, you and I and Logan know what that means, but autoimmune might not be known to a general audience. So would you explain a little bit what you mean?
Of course. So autoimmune basically means where the body's normal immune system is triggered to fight normal healthy tissues in the body. So that can result in inflammation in and around the joints, and that can lead to joint pain, swelling, stiffness, lack of mobility, and over time, especially if left undertreated, can cause joint deformities. So that's contrasted to osteoarthritis, for example, which is what most people refer to when they refer to arthritis in a very generic way. So obviously the physical toll that rheumatoid arthritis can take on patients is quite obvious and gets a lot of attention during office visits. But living with daily chronic pain and difficulty doing certain activities obviously takes an emotional toll that can affect the psychological well-being of patients. And both those physical and psychological factors can then lead to problems in the relationship arena, especially if they're not diagnosed or discussed. And this can obviously have difficulties in intimacy as well.
So therefore, communication also becomes very important with rheumatoid arthritis.
Absolutely. So communication, not just with the partner about what the patient who has rheumatoid arthritis may or may not be able to do, what he or she may have the stamina or the physical capability or mobility to do, but also with the healthcare provider, such that if there are anxieties about certain topics that are uncomfortable to talk about, that open line of communication exists so that the healthcare provider and or his or her team can help the patient navigate through some of those difficult issues.
So now how would a person start a conversation with their healthcare provider about sexual health needs that aren't being met?
Yeah, it's not an easy topic for a lot of people, Dr. Goodwin, and I think one of the advantages that this website, arthritis.com, has is it provides some tools and resources and tips on how to approach the subject, to really empower patients to bring up these subjects if they are bothering them. If the healthcare provider, for whatever reason, is not capable of, doesn't feel comfortable, or doesn't have the time to bring up these issues, it doesn't mean they're not important. It just means that the time and or the resources need to be found to address them because they are critically important.
Okay, now you mentioned website.com, but you went through that fairly quickly. Is that a site that we can recommend to people to get more information?
You certainly can. It's called arthritis.com. And on the site are stories, information, guidelines, even tools and techniques and activities and exercises used to better communication with providers as well as to enhance the quality of your relationships and intimacy.
Okay, so basically it's www.arthritis.com.
That's what it is.
Okay, that's good to know. Is there anything else that you think you want to highlight, either of you, while we're still on the line?
Yeah, so just from a rheumatologist perspective, I'd like to highlight that a patient is not alone in managing their rheumatoid arthritis. They do have a support network of family and friends and really are encouraged to utilize those support networks. And we encourage patients to bring in a loved one to help them remember certain things that are discussed. And the second important thing is to feel empowered to bring up issues that aren't being discussed. So if your rheumatologist, for example, is focusing on maybe just objective measures of disease activity, is to bring up some of these other things that might be a little more difficult to talk about.
Okay, and Logan, what do you want to leave our audience with?
I want to remind people that sexual health is a part of our overall health. And it is emotional, it is physical, it is intimate, and sexual function is a big piece of it. So if we're only talking to our partners but not talking to our providers, we're definitely missing a big piece of the puzzle.
Okay, well, it was certainly good talking to both of you, and I'm sure my Health Power audience will find this information useful. So let me thank you very much for having a chance for us to chat today.
Thank you so much.
Thanks for having us.
All right, so long.
Take care.
Bye-bye.